questions. I don't think there's going to be anybody joining from the back of the room, so we'll do a round of introductions, I think. So if we could begin with that, I am Deputy Jonathan Reniff. I'm the chair of this panel, and on my left,
Deputy Steve Ayer, Vice Chair.
Deputy Alex Curtis.
Deputy Karen Wilson.
and if you would like to minister.
Deputy Tom Bennett, Health Minister.
Jessica Hardwick, the Programme Director. Deanne Brach, Interim Business Lead for the programme.
Okay, good.
And Chris Byrne, Chief Officer.
Good.
ACS.
Thank you very much indeed. So we'll get going. I would like to just start by saying a thank you from our side of the table to the team for cooperation and help as we've got underway to do this work, and to just acknowledge that we've had good cooperation from the team and the Minister, and we very much appreciate that, and we all understand the importance of this work and the importance for this work to proceed at pace. And we've also referenced that we appreciated very much the tour that we were given of the various sites connected to Overdale and Gloucester Street, and the attendance of the Minister and others there. That seems to me a good start for us all. If I could begin with a question, a scene-setting question, really, Minister. Could you set out an update on the overarching timeline? What are the steps that we can expect to see over the next few months?
Well, I think everything is going roughly according to the plan that's been in place for over a year. Possibly, would you say, a few weeks, 2 or 3 weeks in delay of where we were expecting to be, but pretty much on time. As you know, the outline business case should be with you at scrutiny on the 31st, and the plan is to include it in the government plan, but I know you have a proposition to do otherwise, and that's going to be debated, as I understand it, on Tuesday.
Can you, so that the outline business case will come, the government plan will come. What can you tell us about the sort of progress of work that's leading to different stages of it, for example?
Well, as I say, I'm better to hand over to one or two of the two girls because they know those things much more intimately than I do. So,
by all means.
I think that's,
In
if
terms
you want
of
an
the
accurate
outline business
picture.
case.
No, I've been thinking in terms of just the
Practical
work
work.
programme. You know, what things
Yeah.
are you looking at as landmarks over the next few months that the public will see and think, progress is going on?
So I think people will see progress in terms of the demolition works that are happening at Overdale. And obviously that's been possible because of the decant of all of the services that were delivered from Overdale previously, and they've all moved into the facilities that have been delivered, like the Enid Kenno Health and Wellbeing Centre. They've moved into St Ewolds from the Westmount Centre, which is only a relatively recent lease, as you know, through the Standing Order 168 process. We were able to take that lease from the parish of St Helier, carry out some minor works and move people into that facility. It's only because those people have moved from the Westmount Centre that the whole of the site is now available for demolition. That building will start to come down in the next few weeks, and then should be complete by autumn this year. So that will definitely be a landmark. I think another landmark will obviously be the government plan, and as we've just talked about, the fact that that is going to be lodged in the next few weeks. It includes a chapter on the new hospitals, new healthcare facilities, setting out the funding that had already been set out last year, at the end of last year, for that capital sum of £710 million to deliver the first phase of the programme. So that will be another milestone. And as Deanne says, the outline business case, which is really the justification for that expenditure, showing what the costs are, but also the benefits. That document will complete its governance, complete its internal scrutiny, and of course be handed over to you for the assurance that I'm sure that you will bring through scrutiny over the summer months. For then, depending on the success of the proposition next week, either to back up the debate that will follow as a consequence of that, or in the government plan towards the end of this year.
Okay. What about a planning application?
Planning application will also be ready. So I think we'd put more recently that it was going to be Q2, Q3. We hope that we're going to have a soft draft of the planning application towards the end of this month for then lodging through August.
So lodging in August, do you
Yeah.
think? And does that involve, have you been involved in discussions with planning officers to get to the point where you feel confident that you're getting a good chance of success?
So we've asked for formal pre-application advice from planning officers. We've had many meetings with regulatory authorities, with planning authorities. When I say regulatory authorities, I'm talking about the highway authorities, who are obviously important. We've got the parish of St Helier, who obviously are an absolutely key stakeholder, because some of the highway network is theirs, and some of the adjacent verges that we might want to use in places is theirs. The active travel route is through their parkland, so we'll need their agreement. And of course, we've had lots of meetings with planning and the Jersey Architecture Commission as well. We've got some meetings next week. But as I say, what we'd really like is some formal pre-application advice from them, which will then be, those comments can be hopefully taken on board.
Whilst we're on the subject of St Helier, have you had any direct negotiation or conversations with the Roads Committee, and have you met and presented to the Roads Committee recently?
So we've got that in our diary to do through July and August. So we've been asking for a meeting to be able to present to the Roads Committee, because obviously they are a key stakeholder.
And just on the planning side, have you spoken with the Minister for Environment as to whether he has intentions on how it will be determined, and then if that will have an impact on your timelines?
So I think that we are going to write a letter to ask the Minister for Environment for his view. Sorry, I'm speaking. I
No, that's why you carry you on top of the detail. But...
So, however, the previous view was that I think until an application had been received, it would be very hard to prejudge the kind of determination process that there might be from the planning application.
We're not anticipating a planning inquiry.
We don't know.
It's not for us
the
to
Minister
determine.
for Environment who will determine.
It's obviously a reduced programme compared to the one that's already passed, so we're hoping for that to be the case.
And just finally on timetable, can you say anything about what might be expected in the next year, let's say, on other aspects of the programme, such as the redevelopment of Kensington Place or the Health Village or any of those
I think
aspects?
it's safe to say, and I'll hand over for more detail, but in principle, the focus has been on delivering the acute, just as well in many respects, because certainly on the ambulatory site, there are still some ideas coming into the frame now about what might go on there. So I think if we'd have put too much focus on that, it probably would have been wasted already. So the idea is to get everything in, get the planning application through. That buys us a little bit of time, and then we can start coordinating what's going to go elsewhere. So I don't think there's any, well, in an ideal world, it'd be nice to have it all sorted out, but I think we've got limited resources that we can put in at any given time. So the idea is to get the planning application in, then change the focus slightly. I don't know if either of you want to add a little bit more to that in terms of the detail of that.
Yeah, and I think the public will see some progress, hopefully, on that site over the coming months, because we always said that we would really like to go out to procure a advisor team for the Kensington Place Jersey General ambulatory site. We've done a little bit of work proving what might be possible on that site, but really that work there really needs to be progressed in order to come up with a more complete plan, I suppose, before we would then go through more detailed design processes. So we'd hope to go out for an advisor team this year, and they will enable us to develop those plans along. We also know that the Andium site, the ex-Andium site that's been procured for the new healthcare facilities, we're very mindful that there might be some uses of that site that would be very useful for the operation of the Jersey General Hospital as it exists today. So we have been talking to HCS about what they might want to use that site for. There's certainly estates uses of that site. They're bursting at the seams. I think the fact that there's scanners in car parks shows that it's a really tight site. And I think that, ideas like contractor compounds, for example, where at the moment there's no facility for such things. At the moment, there's a number of operational vehicles being parked there. There's an element of storage on the site. Could we do something like staff welfare on that site, because there's not very many showers for people who might want to cycle at the moment. So I think there's some really positive uses of that site that could be in the kind of medium term, meanwhile use. But of course, knowing that in the longer term, we've got the ambulatory facilities to deliver, and obviously that particular site is absolutely key to delivering that future delivery, because otherwise you've got nowhere to work.
Moving on, Minister, just in the context of the politics around this, you said, I think, to the last panel that you were confident that you had political support for the multi-site programme. And I wondered whether now we've had a change in the Council of Ministers, whether you still feel you have complete support amongst the Council of Ministers.
I think I can speak comfortably about the Council of Ministers. I think that's fully supportive, and I would hope that the remainder of the Assembly remains fully supportive, because as you can see, the programme of work hasn't really changed well, it hasn't even changed to a minor extent. So we're in no different position now than we were sort of 6 or 12 months ago. So unless somebody knows something I don't, I'm planning on the Assembly being continuously supportive.
Yeah, I was wanting you to confirm that the Council of Ministers is
absolutely,
completely behind you.
they're very much behind it. Yeah.
You know, clearly the Chief Minister had taken a different view at various points.
And no, that's all resolved, and it's not been a matter for discussion.
Thank you.
From the outset. So
The programme has a ministerial group, and I wondered if you could tell us how many times they've met, who the members are. Could you just brief us a little bit about the functionings of that group?
Well, as you know, we've broken things down. We've changed the way we operate a tiny bit. We were finding that the meetings with 20 odd people in a room plus was really being counterproductive. There was a lack of focus, so we've broken things down. I think I can't recite it all. I could read it all to you. I've got a complete schedule here that I'm happy to share with you afterwards that shows how that's been broken down. But all the same people are being met, and what we're finding is that we bring smaller parties in, and there's a great deal more focus. The non-executives are in, the two clinical leads come in separately. So in that smaller context, everything seems to work that little bit better.
Can I don't quite understand when you say when they're in what?
In meetings, as I say, there's a schedule here. I think it's at 22 different.
Yeah, so what happens is there's a weekly political lead meeting, which obviously the minister attends with his assistant ministers that meet with the programme team. And then once a month, there's a standing invitation for other ministers to join that. So in 1 in 4 of those, it can be all ministers rather than just the political leads. In addition to that, there's a 6-weekly cycle of meetings with various ministers to discuss risk just as a separate subject. So those are the 2 ways that other ministers get involved in the political cycle. But obviously, this minister is a part of the Council of Ministers, so part of the agility of this framework is if there is anything that needs to be raised with the whole of the COM team, we just have the ability to take any issue up to them, and that was the cornerstone of that change. So more frequent and smaller meetings, but with the option of others joining whenever they want to try and keep up with what is obviously a very challenging programme. And it was felt that that was a more agile way of dealing with the decision points than meeting in bigger groups less often. So that was the context of that.
That's very helpful.
Yeah. Are many ministers taking up that standing invite to the monthly session?
Sufficient to be useful. Occasionally people can't turn up. The Chief Minister can't attend everyone for obvious reasons. But yeah, there's a very good buy-in. Yeah.
Okay. And have there been any political, let's not say disputes, but sort of, have there been any sort of knotty issues that you've had to deal with at that meeting?
Not that I can think of offhand, and fingers crossed it remains that way. So it's been smooth.
Okay, thank you.
Are there any minutes from those political, the monthly meetings? Are there any minutes published?
We have them. We take minutes of all of our political meetings, all meetings in fact. So,
and is the panel permitted to have?
So we've provided the minutes that have been requested, and we can provide the other minutes as requested. Yes.
That's fine, thank you. Thanks very much.
Over to you, Steve.
Thank you. Please can you describe the current processes in place for managing the risks associated with operating in the general hospital?
Sorry,
More in regard to the
General
ageing
hospital.
facilities,
Yeah.
the ageing facilities at the general hospital.
okay. But you're asking me to describe,
The processes for managing the risks.
I know, I'm not in a position to
that's
provide that level of
So
detail.
I think, and as well, this is the new healthcare facilities team, and as you point out, Chair, it will be the Chief Officer of HCS who would probably be best placed to answer that question, because in the end we're charged with the new facilities, and whilst we're very, very mindful of that being, our strategic case, essentially as part of our outline business case, the need for a new hospital, and that's absolutely because of the 6-facet survey that was undertaken there that highlighted areas of risk to the existing facilities that of course are being managed by the estates team. It's really the estates team within HCS who are managing those maintenance risks.
I'm happy to hear from Chris on that. I think it's worth pointing out it is part of our terms of reference to ensure.
I'll make a comment on it after Chris, because
Oh,
Chris
no,
has got
sorry,
the detail.
Minister.
No, I'd rather hear from Chris, but I'll just make an overall comment.
This is about managing the existing risk on the estate.
Yes, please, Chris.
We have about £5 million a year that have been allocated. We have a similar amount for 2025 that's been put forward in the government plan. It's my words, probably sticking plaster type efforts just to ensure that things are safe, safety is maintained, that the leaking roofs are patched up. So there's nothing significant really. It is very much about keeping things going until such times as we are able to move. So, the level of risk is managed, but there is risk there. And I guess the reason we're obviously pursuing a new hospital, but it is as safe as it possibly can be, considering the funding that we've got and the state of the buildings.
And are there any particular current focuses of interest around risk management in the general hospital?
As regards to the estate, no, I think it's more general. We had some issues around, remember I'm trying to think of the name now, what's the cement problem? Yes, you're an engineer. That's it. In pathology, where we've had to do some remedial works, we actually got some additional funding to do that. But so those things pop up every now and again, but generally it's routine maintenance, just keeping things going and keeping it safe for patients and staff.
But I would make the comment, because I know we're being filmed, and from a public assurance point of view, it's a very, very good team there, consistent team. It's been led by the same individual who knows the job inside out, and the talks are consistent about making sure that the funding's available, the appropriate amount of funding to take us from now to the point at which acute moves out.
And finally, what are the priority maintenance and refurbishment works to take place in the general hospital for the remainder of the year? I presume that's for Mr. Bone as well.
It is, and I must admit I don't have the list on me, so I don't want to guess. We can certainly provide that to you in writing. There'll be nothing, there'll be a whole range of different things that we're spending that on, but no particular sort of big item. But we can certainly, I'll get John Carter, the head of estates, to provide that.
In future meetings, if you wanted to focus on that, and if you let us know in advance, we bring John Carter across, and he can answer chapter and verse on all of it.
General question.
I think this is, we see this meeting as a baseline exercise in a way. We're just letting you know what we're interested in.
That's fine. But if that was, I'm
getting
just saying,
your basic information.
if it was a point of particular interest, he would be the right person.
Absolutely,
to have.
and it's just a general
Yes,
query
I
to
think
find.
John will be able to give you a great deal of detail that, if you wish.
And we actually, we do have some of that detail, and I think it's probably right that we pass that over to you, after the meeting, if that's acceptable to you.
It's a programme that works for the last 4 years.
Thanks very much.
So.
Thank you.
Okay, I think we do have a couple more questions on this. If maybe we surface them just now to baseline, and then Chris, and maybe this is something either you can answer now or bring back with those who are more informed. Focusing in a bit more on this year in the General Hospital and works. Funding was agreed in the 2024 government plan for refurbishment works, and it was just for the panel to understand year to date, really, what works have been undertaken with that money. Acknowledging you said that much of it is general.
No, I think I think I'm going to have to get that back to you, because I don't. There'll be a lot, but generally small things. So
Not but small.
yeah,
Okay.
Okay.
we're definitely going to spend the £5 million.
That's good to hear, I think, isn't it? I think we might as well move on from that subject area. We did have a few more questions, but I think given your answers, I think it's a good idea to move on. Can you, for the benefit again of the public, perhaps provide an update on the demolition work at Overdale and where that's got to, and how you see it progressing from here?
Once again, we had a site visit. As we've just been told, the main Samurai building comes under. They've done the soft strip. I think the main demolition starts in three weeks from now, approximately.
Probably even less, probably
give or
2
take.
weeks
It might
now,
be a
yeah.
fortnight. Ongoing from there, as I say, I'm not aware of the absolute detail of the demolition on the site, but I don't know which one of you might be able to.
Yeah, I mean,
Further
they're going to work from south to north towards the crematorium and demolishing that building, and that will conclude September, October this year.
So the entire demolition will be finished by then?
I mean, there are some small elements of demolition that might be left, but they will probably form the next phase of the project rather than forming part of this. There's also Thorpe Cottage, which needs to be recorded. At the moment, the contractor's using that as their base, so in time that will come down as well.
And then in terms of, I think it might be useful for the public to understand the efforts that have gone on there to sort of make the site, to be efficient about the use of materials in the site.
Absolutely right. So, part of the planning condition was to be able to submit a site waste management plan. Part of that site waste management plan set out the fact that we were going to reuse as much of the material as we possibly could. And so on a site visit, you'll see lots of spoil heaps, and essentially they are the material that we will be able to use in the next phase of construction for things like haul roads or for laying down mats that you might need in the future to be able to construct. So in the end, I think it's been very useful. There's been other initiatives that have taken place there. So, for example, any timber, if it was useful to Acorn, then we've made that available to them, and they've been able to collect that material and obviously been able to reuse that material. I think there's some steel on site at the moment. I think we're looking for a home for that. So if anybody's interested, then maybe they could contact us. Yeah. So it's absolutely recognising the fact that obviously solid waste for the island is an issue. It's, I think there is a planning application at the moment. I think I heard it might have been approved this morning, but I'm not sure. That's our colleagues in the INE, but we're kind of keeping track of it. So we want to absolutely minimise waste, and we'll continue with that philosophy. Any material that can be reused, obviously we'll look to do that.
And attention was drawn to the panel when we visited about the asbestos issue.
Yes.
And we wondered how that is being dealt with and how it's being disposed of.
So a key element of construction works is to make sure that whoever you employ to do your asbestos work has a licence to do that work. We have used licensed providers in order to safely remove the asbestos and obviously deal with its disposal in a manner that meets all of the regulations. So, and that's all complete now.
That's finished?
Yeah.
And do you think that the practices being taken for demolition and remediation of the site should be really shared with the public? Are there lessons actually the wider industry can learn from the way you've tackled such a large site?
I think that the industry, I'd love to take the credit, but I think that the industry are very innovative, and actually what we've been able to do there, you would see reflected island-wide. I think that there's, sometimes there isn't always a use for that material. So it's making sure that we've got innovative uses of that material going forward. I think that's going to be the key. We're lucky, we're a big site. We've got lots of opportunity for filling on the site as well as for temporary uses. So we're able to manage it ourselves, but I can see on other sites that perhaps are more constrained, it's how then it would be dealt with and the kind of reuse of that material. But it really is, my colleagues in I&E who would be the experts in that area, I think.
Yeah, you couldn't have done that on Gloucester Street, for example, could you?
It's the crushing of
impossible,
materials on site that becomes quite
It's been a big-
problematic in a very
it's been a
urban
big plus,
setting.
actually, in terms of saving transport.
Yeah.
Can I just ask a question about your engagement with the public around
Yes.
the demolition? How's
Yes.
that going?
So we've had neighbourhood forums. We've got a member of the audience here who is a regular at our neighbourhood forums, takes a very big interest in them. And what we've tried to do is tell people what we were planning to do. We've kept in contact. There's some members of the public who have contacted us. So, for example, there was a spoil heap that was close to one of the residences. They informed us. We arranged for it to be reduced in height, and then they were satisfied with that. So we've tried to be approachable, and if there's particular issues, we've tried to address them. I think it was one of our neighbours at a neighbourhood forum that pointed out that perhaps our signage for the crematorium wasn't the best, and so we improved it. And hopefully that's helped the crematorium and our site. So we've really tried to be proactive with our neighbours, and if they had any problems, we've tried to deal with them quickly.
Are there any particular access issues that are emerging as a result of the work that's going on up there that need consideration at all?
What kind of access?
Road access issues?
Do you mean like vehicles going
General
to the
traffic.
site? Well, because of the amount of operation that we've managed on site, we've been able to reduce the number of vehicles. There's also been a very strict mandate that larger vehicles should exit north towards St John's Road and Tower Road, and the smaller vehicles are allowed to go down Westmount Road. I think that some people, unfortunately, that message wasn't heard, and so I know that the contractor has done site talks, toolbox talks to reinforce the fact that it was really important that people use or follow the traffic management plan that's in place for the works.
Okay, that's
Yeah,
helpful.
so it has been managed. well.
Sorry, Tom, the
It's safe
Minister.
to say that up to this point in time, there hasn't been a great deal of toing and fro from the site, other than the operational vehicles on the site, because you've not really started to move great. When you start doing the dig out, that's going to be different. When you're bringing in building materials, that's when you're going to see a real uptick in terms of transport to and from the site.
And getting back to the piles that we were talking about, there's a lot of aggregate being collected. Is that going to be recycled within the project?
That's what we hope to do. We think it's sufficient material for us to be able to use on site. We don't believe there'll be a surplus.
In terms of what's going to happen to the site next, you're going to finish in November, I think you said, probably with demolition, and you're putting in a planning application. So there'll be a gap where the site will be clear, but nothing will be happening. Is that your expectation?
Well, if you know more detail than I do, no, but the plan is to have some continuous work, and I think a certain amount of dig out can be done based on the previous planning application. So I think the idea is to maximise the work that we can do within the parameters of the permit that's been granted, and stuff like site hoardings and so on. But once again, these two ladies are closer to the detail than I am.
That's absolutely right. We're trying to do as much as we possibly can under the previous permit, but not go too far, because obviously, it is a process, and at the end of the day, we can only do what we can do within the permit that we have, and we have certain conditions to clear. So everything that we do, we have to submit our methodology to the planning department, to regulation department, and it's only when they agree that we're able to do the work. So I suppose we hope that we will be able to discharge the conditions that are around hoardings. To some extent, it's a matter of public safety, so we think it's probably quite an important task to make sure that the site is safe. There's some ground clearance that we can do. We've still got some areas of hard standing. Things like asphalt is harder to recycle, so that might end up having to go down for disposal. But there's other areas that we might be able to grab up and use in some meaningful way. We've got the reduced level dig that, depending on the ground conditions, we may or may not be able to do. And then there's things like the construction site itself. So it's going to need a drainage supply. It's going to need an electrical supply. It doesn't matter what you're going to do there. It's going to need, those things. So there's works like that we hope to continue on, so that we can continue with progress, really with that construction starting in 2025, we're going to have a fantastic basis on which to start that construction.
And can I clarify just one thing about the planning application that's going in? Is it a global planning application that will cover not just everything on site, but the access, roads, any work that's being done right the way down to town? Anything to do with that site will be in one planning application.
It's in entirety, it's all,
Yeah.
it's in
Yes.
one piece.
Okay, thank you.
Thank you. Moving on. Minister, the panel understands that a questionnaire on the Overdale Acute Hospital design concept concluded on the 4th of June. Please could you provide an overview of the number and range of responses received?
I'm not in a position to give
And
you
I-
that full, and then once again, I'll have to put that to
Yeah, if anyone else has knowledge of it.
Yeah, so I think that there was about 1,700 people who actually went to visit the virtual exhibition itself, and we received about over 200 responses from that questionnaire. And the really good news for us was that the majority of those returns agreed with the strategies that we'd set out at the virtual exhibition. So that included things like the timeline. People strongly agreed that we should deliver in accordance with the timeline that was set out.
Everybody was saying we should slow it down.
Well, I'm not saying nobody. I'd say the vast majority were definitely strongly agreeing that we should. And likewise, the other kind of concepts that were set forward in terms of, stepping down the building, away from neighbours, things like the landscaping strategy, things like the do minimum for the highway. I think the active travel route was perhaps the thing that people saw least benefit in, but people still agreed with the concept of providing one.
And according to the responses, how has the survey been analysed and incorporated into the design process in relation to the planning submission for the site?
Absolutely. So that was the kind of main purpose of doing that consultation. And really, in terms of the planning application, that's perhaps slightly why we're slightly behind where we thought, because we had such a good response back. We do want to make sure that we can incorporate as much as we possibly can. I suppose the fact that most people strongly agreed with the strategies that we put forward was really good news. But there were perhaps some elements that might have come up that we might not be able to incorporate, but at least we're having a think about how we might be able to do anything more. People have asked about more stepping of the building. It's going to be difficult because of the function provided by the buildings. But I guess, we're looking again, seeing what we can do. I'm not sure we will be able to deliver on that one. But and you'll see how we've responded to each of those when we submit the planning application. With it will be a statement of community involvement, and that will set out, this is what you told us, this is what we've been able to do. These things we weren't able to achieve because of the various constraints, either of the site or the brief.
Sounds like we might be setting aside quite a few weeks for reading that application.
Yes.
And will you be releasing to the general public all the responses, the written responses that you received to that questionnaire?
I think that we wouldn't release all of that in that detail, but I think we will reflect it in the statement of community involvement.
Thank you.
Yeah. And that's a public document. Of course, all the planning documents will be publicly available.
Was there anything that spiked in there in a sort of problematic way? Anything that made you think, ooh, I wasn't expecting that criticism or that sort of, that angle?
Genuinely, I don't think there was anything that that really took us by surprise, or we thought, oh no, we must, no, I don't think so.
Okay, that's good.
Okay, thank you. Minister, the panel understands that the previous government facilitated a discussion forum between the construction and supplier industry in November last year. And it was in relation to the programme specifically. Could you advise the anticipated split between off-island contractors and local contractors in relation to the programme? Do you know the details?
In terms of providing an absolute split, is it still not a little bit early in the day? That's progressive. The engagement with the local construction industry is continuous. It's ongoing. I think you had one this week, yesterday. So we're just trying to ascertain how that's going to work. But that will be pieced together as we get closer to appointing a main contractor.
Okay.
I don't know if you've got anything else to say on that, because I know you've been liaising with them.
Yeah, and
a
I
lot.
guess this comes back to the programme of works, doesn't it? And how much we can actually deliver locally that's outside the main building, as it were. So I think here, you know, the projects that we were talking about yesterday was obviously the demolition, which was completed by the Jersey Development Company, the facilities management hub, which is the refurbishment of the Jersey Water building. We've just been out to tender for some advisors for that. That will be a local team working on that project. We've got the Westmount Terrace development, which is just trying to have a meanwhile use for those properties there. Again, that's we've just had the tender returns on that for appointment of a design team to do those studies, to be able to see what we could meaningfully do. There's all of those development works that we talked about that we can split out from the main contract that can come early. So the things that we've talked about, as well as things like the site welfare and officers, for example. But, you know, we can have a good guess of the contracting team that we might need in the future, and consequently the facilities that we might need. And in fact, we've got to have that information anyway, because we've got a planning application to submit with all of those details. Yeah. We've got the Westmount Road and St Helier Highway minor modifications that we're going to do now, as well as the drainage for the hospital itself. We've got to get the stormwater down towards the West Park surface water separation scheme. We've got to get a new foul connection in. We've got electricity connections to get in.
So how are you managing the whole sort of procurement of the contractors to actually manage that scale of work?
So we're using the portal, the Government of Jersey Proactive portal, and a message to contractors yesterday and designers was for everybody to go and have a look at that portal and make sure that they're making use of those opportunities.
And are you getting a lot of interest from contractors on the island?
So at the moment, the ones that we put out were mostly for the advisor team, but we did have a room full of contractors yesterday evening, which was really good to see, where we could talk through all of those schemes and
on island contractors. Yeah.
Just say there's a full schedule, an up-to-date schedule of where we are, and that's available to, if you want. That may change a little bit over time, but I think that's certainly at this point in time.
Just to flip it just for a moment, if you do end up requiring contractors from outside the island, what feelers have you put out? If it ends up coinciding with South Hill redevelopment, St Saviour's redevelopment, and so on, there may be a lot of work going on, and you may need to draw in from elsewhere. So, is there a contingency plan for that might expand or contract according to where we are at the time you're building?
I've got a couple of comments, but I'll make those at the end if you want to provide the details.
Yeah, so I think with it being healthcare facilities, the thing that's different is all of those mechanical and electrical services. And they are something that they are very different from the kind of developments that we normally do on island in terms of office and housing. It's just another level, and the criticality of it, obviously from the clinical perspective, you cannot get it wrong. So we know that we will need some help in delivering these facilities. We think that it can't all be done on island, but we don't know what combination. And so, as you say, what we really want to have is some conversations with people about how can we best blend that expertise in that area with the supply of and capacity and capability of contractors on island. So we've just started with those conversations now.
That's helpful. I think one of the things that we just wanted to get for the public was to just understand what kind of skills you might be looking for that perhaps aren't available in the island at the moment, and how you're going to raise the interest in that going forward.
So we've already started the conversations. So there are frameworks within the UK, within Europe. There are people who build healthcare facilities. We've already had a few conversations with those people, but we need to do it in a much more open way. And so I suspect there's, what we're planning is some procurement process where everybody who might be interested in delivering these facilities could express their interest, and then we can then have some more formal procurement process but it'll be some sort of blended team that we're looking for.
Will you look to the construction industry to help you with that, or is this something that will be taken through the programme?
That's really the purpose. So exactly yesterday after the meeting, we're going to issue a questionnaire to the local industry to say, how do you see yourself fitting within this picture? How can you help us to deliver this? Because we need the whole island to work together basically to deliver this thing. It is such a big thing.
Just go back to your original question, and I may have got this wrong, but were you expressing a concern that we might be over-absorbing local capacity and leaving the remainder of the industry short of capacity? And I just wondered if that was where the question was.
That in the focus on making it an island project, we might miss the fact that, oh my word, we actually are going to need help from outside, and we may not have advanced as far down that road as we have advanced down the road of engaging with local contractors.
And I think there's been an appreciation, as you've heard, from the outset as to, I think, these good folk know exactly what we haven't got here, and that's been understood from all of the experience that you've had in previous projects.
And the conversations that we're having with the local construction industry as well.
I would say there's great clarity in what can be provided locally and what's required from elsewhere. And
Okay, thank you. Can you confirm whether ministerial oversight of contractors appointed to undertake works on the programme remains with you or with the Minister for Infrastructure?
I think there's the ministerial involvement only happens at 10 million plus, does it not? The actual day-to-day stuff, but whether that rests with the programme, I think that would rest with me. I think that's my understanding.
Okay.
Unless somebody knows information to the contrary.
Somebody comes steaming in through that door.
If Andy wants it, he can have it, of course.
Okay, so if we were to look in the programme manual, we would find
You will
the
find
clarity
that it
around
says there is a scheme of delegation published in the programme manual that sets out that.
Okay.
Yeah, and the individual layers of those authorities.
Thank you, Deanne. That's reassuring.
No problem, Minister.
All right. The panel understands that the overarching programme of work is made up of a number of projects, as you've clearly articulated. Can you just outline, again, for the benefit of the public, how the work is going to be split amongst contractors appointed to undertake programme works? So how are you going to do that? How are you going to decide? How are you going to appoint the contractors?
I'm not quite sure of the detail of that. I'm not quite sure the meaning of the question. When you say how are you going to decide?
Yeah, so given the sense that you've actually got a number of projects that are going on, are you going to have a main contractor with subcontractors, or are you going to, have you got a different way that you're going to do it?
No, that's my understanding, is that you're going to have a main contractor and draw in as many as you can. But as I say, some of this will be underway and done with local contractors before the main contractor comes on site. So it's a progressive thing, but in terms of the shape of the main thing, there will be a main contractor. In terms of how that main contractor interacts with the local contractors is yet to be defined. But unless you can actually offer more refinement to that, I think that's basically it.
Okay. Will you be able to give us some idea about who's responsible for managing the procurement process on that basis, and in what way they're going to be able to pick up that particular issue?
So, I mean, the programme team fundamentally will set out what we think the procurement process should be, and that will be formalised in the coming months. Mm-hmm. So they're papers that you'll receive yourselves about how we see that procurement process rolling out over the next few months. In essence, we've got a commercial management group now that we've set up so that we have monthly meetings with the commercial department in the Government of Jersey to make sure that anything that we're proposing would conform to any of their requirements in terms of public finance manual, in terms of their commercial framework. So it's really for the programme team to set out, I believe, the procurement process, but clearly that needs to be approved by commercial services who fundamentally are linked into Treasury now.
Okay, and do you foresee any particular issues with the fact that you've got some contractors working on some aspects of the programme prior to appointing a main contractor?
I guess in Jersey, we're kind of all used to working with each other all the time, aren't we? We all have work relationships, professional relationships with with various contractors. And actually, when we did the analysis, we've actually placed contracts with many of the contractors that there are on island. I think that fundamentally, part of any procurement process would be that check on capability and capacity. And that's what will need to be proved through the procurement process in order to demonstrate that it can be delivered in the timeframes we need. Mm-hmm. So I think that all of that will be part of any procurement process.
Mm-hmm. I get that with the procurement process, but I'm just thinking in terms of the main contractor, you know, do you want to pick up on that?
No, we'll carry on with the question because I think I know where you're coming from. But if you could repeat it, just to make sure we're clear.
Yeah, no, it's really about you've got a range of contractors already in place, and if you were to appoint a main contractor, how you might.
You're worried about the interface between somebody coming in and starting work on a site that a number of other people have contributed to. And I think as I say, I'm not a specialist in this area, but in a minor way, I've done sort of similar things, and you have to be very, very clear about what responsibilities rest with who at any given point in time, and that has to. But I mean,
that's absolutely the answer.
These good folks will know
got
much
to be
more
very
about the
clear.
detail of that.
So that
does
built
present.
into your procurement process.
You know, as I say, if you appoint somebody at a very early stage, they're responsible for everything at the beginning, but you pay the price for that, don't you? So I think the line that's been taken here to try and make it as economic as possible and as efficient as possible, that we've gone down this road. But you're quite right to identify the point that you have to be very, very cautious when you've got a number of people involved in terms of where responsibilities lie on an ongoing basis.
Okay, thank you.
That's a point well made, actually.
The funding and government plan question, which obviously we'll be debating next week. You were part of a government that brought forward the last government plan, which included the words that we would bring forward a standalone proposition to seek approval for delivery of phase 1 of the programme and its financing. What's changed in your mind to change the approach?
Well, looking at the way things have developed and the fact that nothing has basically changed. There are no surprises to anybody. The budget remains the same, the programme remains the same, and our timing remains broadly the same. And I would say the point to make here is that it's the government plan that's changed and not us. So on that basis, it just makes sense to put it into the government plan. That's my take on it.
When it was written a year ago, though, we weren't anticipating a huge change either, yet still there was that commitment to do it on the basis of transparency.
But that question supposes that there's going to be a lack of transparency in the way we're doing it here, and I don't see that at all. I think a year ago we weren't aware that things would have gone as smoothly as they've done, and that things would have stayed exactly as they are. So I think we're in a good position now, and that's where we're hoping to go.
The other point that we've raised in the proposition is to do with other costs that go beyond the pure funding of the acute. And do you not feel that it would be better for the island to understand what those costs are likely to be?
Not at all. That's the point. That's the point at which we really would come into disagreement, because I think that stands a huge chance of derailing the programme. As we've already made clear, there's not been a huge emphasis on the other two sites at this point in time, because everybody is clear that we need an acute facility. Now, 95%, I might get the percentage slightly wrong, but the focus has been on making sure we get that underway, get a planning application in. What we're putting on the ambulatory site, as I've explained earlier on in this meeting, is still something of a movable feast. We're undertaking discussions with people. We're looking at the charitable sector and wondering whether there could be a hub for the charitable sector here. Doing a lot of work with public health in terms of having a new illness prevention programme which might require facilities for screening and so on. So really what we're trying to do is ascertain all of the moving parts that need to be put together on that site. And similarly with the site at St Saviour's, that's still a slightly movable feast. So there'll come a time where we have to settle down and say, right, we've got as many components as we can together now. Everything is outdated from the day you actually start building, but we want to leave it till the appropriate last minute before we start that planning process. If we had to stop now and do all of that work, price it all up and come back to you, I don't know how many months that we'd put onto the programme, and that would really be fatal. So I would resist that wholeheartedly, and will.
The other aspect of it, though, is that it's very, very hard for the island to know whether it's getting value for money if it doesn't know, for example, things like what facilities might be down in Gloucester Street and up in the hospital because there may be inefficiencies in that that arrangement. For example, you might have to double provide X-ray facilities or whatever, but we just don't know because we don't have visibility. So it's very difficult to judge whether we're getting value for money.
No, I don't agree at all. I think we're as each day goes by, we're closer and closer to knowing what. Once you've got total clarity on what's going at the acute centre, and I'd say, would you agree that we're pretty much in that position now? Mm-hmm. By virtue of knowing what you've got on the one side, you pretty much know what as a consequence will be needed on the other. But there are other component parts that are on that side, and they're still movable. So long as you know what you're doing on the one side and you have clarity about that, and you've got to get on and do it, you get on and do it. And I don't have any problem at all about the way things are going and the timelines that we've got about the other two sides. But I do fear that once again, if we get into this business of absolutism, we're going to absolutely have carnage, and that's something I'll resist wholeheartedly. We've said all the way through this, we've got a timeline, we're going to do our level best to stick to it. And I can't see there's a value for money issue here at all.
You don't accept that because you're not on one site, that there must be some inefficiencies compared to being on one site.
I accept that I think we've accepted from the outset that there might be some inefficiencies. There are some benefits as well, and they have to be traded off against each other. But none of that results in a value for money issue.
Well, surely it does. I mean, accepting we have a multi-site hospital programme, it's still valid to ask what are the inefficiencies in that the taxpayer may end up having to pay for.
The only other way of amending that would be to go back to the drawing board and starting the whole process all over
We
again.
do have the outline business case, of course, which does explore the revenue costs of the multi-site solution and does demonstrate that actually there is very little difference from a revenue perspective in terms of trying to deliver an acute facility around the existing Jersey General Hospital, not to modern day standards, not to deliver all the good adjacencies that you'll get on the better side. It really is the poor relation to having new facilities at the acute hospital, but it demonstrates a value for money case in terms of it is not double the cost to run it in that way. And of course, remember, we don't have single site solution for healthcare at the moment on the island. There are many different healthcare facilities across the island. Yes, there'll be a slightly different separation of services, but that doesn't mean to say that it's going to double the cost. And we can absolutely prove that in the outline business case. And we can also demonstrate the alternative, which is to be able to...
We're at a slight disadvantage here.
Well, you are and you aren't.
It makes no odds. The principle is quite simple. We are this far down the road and we're very close to putting another planning application. If you went back to the sort of do nothing or do minimum solution, you're back where you started, and we go through the whole argument again of starting the whole process again. Are we going to build on Gloucester Street? Are we going to identify another site?
I don't think anything we want, in any way we want to go back to the drawing board. What we want to do is to understand the costs, so that when we make these decisions, we are fully sighted on all the costs, including not just the cost of building an acute at Overdale, but the costs that arise out of the multi-site solution.
We're not in a position to deliver that now, and we're not going to be. I think we have to accept that. You know, you've got to accept if there was a financial crash or there's World War III or something else, you may just have to say to yourself, well, we've got our acute hospital and we just have to make do with what we've got at the ambulatory site in extremis. So what we are on the point of having is at least we're going to have an acute hospital, and these things run in phases. That was the whole idea of this, so that we had the flexibility, we had the financial flexibility that if the circumstances changed, we could move accordingly, and that hasn't changed.
I think there is information available. So I think firstly, the strategic outline case information update that was issued before the end of the previous government last year in November does already set out the fact that the revenue costs do not double as a consequence of the proposal that's been put forward. And remember that the comparator in that case is not the everything in one place comparator, because that's already demonstrated through the critical success factors that actually that wasn't a viable solution in terms of the financing of such solution. So that was already ruled out on other terms. So the thing that's compared in the business case is the proposal, which is to have the acute facility at Overdale and a do minimum alternative as you require as part of the Green Book Treasury business case process. So that's a comparator. And in that comparator, you know, essentially that's trying to do the absolute minimum to the existing Jersey General site. But even then you end up building decant facilities because as, you know, when hopefully you get to speak to John Carter, the big restriction on what he can do is essentially they're full at the seams. So there's only a limited amount of work that he can do without displacing or disrupting people. So in the end, you end up building kind of decant facilities, but then you don't have the proper adjacencies of them. But that's the comparator that you'll see in the strategic outline case information update. And all of that revenue costing information is there. So, and I believe that all of that information is available to the scrutiny panel.
Just again, for the benefit of the public, Jess, could you just outline when those assumptions were updated?
Which assumptions?
The financial assumptions that you just outlined.
Which financial? I'm not clear on
In relation to the SOC.
So there have been two updates.
Right,
There's one
thank you.
for the strategic outline case update, which
Yeah.
was in November,
Yeah.
and then we've updated the financial assumptions for the OBC. So that's based on information that was updated from various sources within government, such as the statistics, demographics. All of that has been played into the financial modelling that exists.
Thank you, dear.
And also, of course, the key difference between that, we called it SUI because it's just such a mouthful to say the strategic outline case information update, and the outline business case is that we have the concept designs. So, of course, you know, that's the whole thing about the business case process, isn't it? That as you go along in time, you get more and more information in order to back up some of the assumptions that were made at the time of, you know, the previous business case. So now we have concept design. So now we have a cost plan that actually says the designs that you have, concept designs, it updates the capital expenditure on that, and we're still within the £710 million. And remember, that's for the whole of the acute facility. It's doing something on the existing site, and it's also doing some works at the health village as well.
Yeah.
That's all within
the
the
also ask,
business
is
case.
the OBC going to be made public?
So a summary document will be made public, but the OBC itself will remain private, and part of that is it's an incredibly complex document. Some of the feedback we've got from the reviewers of the 180 pages that I enjoy reading is that it's very, very dense, and it's essentially a financial case with lots and lots of strategy around it. So our idea is that we will translate that into a much shorter summary document, which gives the key messages that people can understand. That's more accessible to the public.
But if a member of the public wanted to see the OBC in full?
Because we have a lot of information in there that's commercially sensitive, we wouldn't release that.
Again, for the benefit of the public, could you just outline what that would be?
So it has an awful lot of detail around very complex information around the capital programmes, individual elements of each of the projects. So all of that is very sensitive information for when we go out and do our procurement. And because that's the cornerstone of the OBC, it's very hard to redact that so that you get the document and then it's meaningful. It's much better to give an overall summary which just takes all of that away and really explains it in terms that people can understand.
I think you mentioned a number of times value for money, and I said the way we're looking to handle this is what's most likely to deliver absolute value for money.
And remember what outline business cases do in the United Kingdom. You know, every single trust, if they want money from Central Treasury, they will produce an outline business case. It's a document that is produced in order to compare to all of the other documents to inform decision making about which hospital will be built. In our case, that's not the argument that we're having here. We're having the value for money argument. The value for money argument comes about through good procurement process, finding the right partners, having really robust contract management processes throughout that process is not necessarily an exploration of the outline business case. The time that we'll really know when what those cost estimates are is once we've got a partner and they say, this is how we're going to do the work and this is how much we think it's going to cost. So all the rest of the information that's in the outline business case are cost estimates, of course, based off benchmarks from the United Kingdom and elsewhere, but taking in the Jersey factor, they're our best estimate of cost at this stage. And that's why, in the end, they are commercially sensitive documents that it's very hard to find on the internet.
Okay, thank you very much. I'm aware that we've just gone past our time by a whole minute. So I would just like to say thank you very much to officers and the Minister for attending, Mr. Bown as well, for our attendee in the room, very special mention. And we will resume the debate about the question of the proposition and funding and so on